Well, good morning all, and it's my privilege on behalf of President Trump to welcome Governor Paul LePage of Maine to the White House today. The President and I are truly grateful for Governor LePage's leadership in Maine. The motto of the state of Maine is "We Lead," and under Governor Paul LePage, that's been true in so many ways, but before Obamacare, it was especially true when it came to health care. We're grateful for his leadership. We're especially grateful that Governor LePage and people across Maine are supporting the new Graham-Cassidy bill, which will not only repeal and replace Obamacare, but it will provide Maine with all new flexibility to return to the historic reforms that Maine was leading the nation with in their Public Law 90. It is truly remarkable. When you look at the Graham-Cassidy bill, what the governor appreciates is this is not just a fresh start for America on health care reform, but it's also a fresh start for Maine. Maine was leading the way in individual market reform with its high-risk pools until Obamacare came along. And since then, their high-risk pool was shut down, was put on the shelf, and it was replaced with the failed exchanges of Obamacare that have seen premiums rise by 55% since 2013 for the people of Maine. What Graham-Cassidy will do for Maine is it will repeal the individual mandate and the taxes and penalties associated with it. It will repeal the business mandate. But what's got Governor LePage and governors across America so enthusiastic is that Graham-Cassidy will use block grants to give states like Maine the ability to craft solutions that will work for the unique situation in the state of Maine. The truth is that what will work in Alaska won't work as well in Maine. What will work in Indiana won't necessarily work as well in Texas. The Graham-Cassidy bill, the President and I are strongly supporting, will give governors like Governor LePage the ability to return to solutions that are working and also advance innovations in Medicaid and other areas of health care reform that will better serve the people of their state. So let me say, Governor, the President and I are truly grateful for your leadership in Maine. We're truly grateful for your support of this opportunity to repeal and replace Obamacare. We're grateful to the people of Maine, so many of which are supporting this effort to return to what was working in Maine. And we're encouraging Senator King, but especially we're encouraging today Senator Susan Collins to join us in this effort, to give the people of Maine, to give the government of Maine the resources and the flexibility to be able to craft solutions that will improve the lives and improve the health of the people of Maine. So Governor LePage, thank you for your leadership, and we're so grateful for your support.
Well, it's great to be here, and it's very, very important for the people of Maine to have the ability to go back to Public Law 90 or something similar to it. The high-risk pool was really helping lower the premiums, lower the deductibles on people in Maine. And unfortunately, what Obamacare did is it robbed nursing homes and home care services. And we need to go back. We've made those reforms. We are helping Mainers, particularly our elderly, since we're the oldest state in America. And so our needs are much different than some of the younger states. And our children. We need to protect our children because they're the future of Maine. And so these are all very, very important things. And we in Maine know what our needs are better than people here in Washington. And the Vice President and the President both recognize that one size does not fit all, and our needs are all different. And so I'm really in big support of Graham-Cassidy, and I really urge the Senator to really take a hard look, both Senators Collins and King, to help Maine people go back to affordable health.